Occupational health and safety, noise and vibration. Noise and vibration. Any sound around us that we do not want or do not like may be defined as noise. While low levels of noise in the workplace are unlikely to cause harm, louder levels of noise can result in permanent hearing damage or loss. The effects of very loud noises are often instantly apparent, but damage caused through exposure to lower levels of sound over a longer period of time may initially go unnoticed. Noise is unwanted sound. Symptoms of hearing damage. Temporary hearing loss after exposure to loud noise, ringing or noises in the ears, tinnitus, difficulty in distinguishing similar sounding words, muffled sounds, background noises making conversation confusing, having to ask people to speak louder or increase the volume on TVs and radios. Note: noise is measured in decibels, shown as dB. Environments of 80 decibels or more require the employer to carry out a noise risk assessment, and control methods should be introduced when they are required. If noise levels are above 85 decibels, hearing protection zones should be established and PPE provided to anyone needing to enter a hearing protection zone. 10. Quietist. Just under 30. Library. Around 60. Conversation. Around 75 is a party. Around 100 is traffic. 110 is a road drill. 120 is chainsaw. And just over 140 is a jet engine at 25 metres. Levels of control. 1. Identify the hazard and assess the risk. This requires a specialist assessment using a noise meter. 2. Reduce the noise by designing systems with low levels of noise, choosing machines with lower levels of noise, enclosing equipment in soundproofing material, lagging noisy ducting and pipes, adding acoustic dampening panels on walls and ceilings, having equipment properly and regularly maintained. 3. Reduce exposure to personnel. Can the job be done further away from the noise source? 4. Reduce the time the employee is exposed to noise. 5. Mark areas where there is a noise hazard as designated areas for protection. 6. As a last resort, if noise is unavoidable, provide personal protective equipment, PPE, and proper training in its use. When selecting PPE, it is important to make sure the equipment is selected carefully with sufficient rating for the noise hazard, fitted correctly, compatible with other PPE used by the workforce, properly maintained, worn whenever it is appropriate. In noise control areas, fire alarms must be supplemented with flashing lights or beacons. In the interest of safety, the wearing of hearing defenders outside the restricted area should be discouraged to make sure employees are aware of sounds around them. Vibration. Vibration is the transmission of force from work processes into the worker. People in the course of their work may be exposed to many sources of vibration. About 2 million workers are at risk. Some vibration affects the whole body, for example, when driving a dumper truck over rough and uneven ground. Here, the vibration in the form of large shocks or jolts is transmitted to the whole body via their feet or the seat. This could cause injury to the lower back and spine. The most common problem is hand-arm vibration, HAV, which is caused by exposure to vibration, for example from using handheld power tools. This can be very disabling, causing severe pain in hands and arms and lack of hand movement and feeling in the fingers. It is preventable but permanent once the damage is done. Have symptoms to look for are tingling in the fingers, loss of feeling and sensation in the fingers, reduced strength in the hands, fingers that go white in the cold and then red and painful on recovery, vibration white finger. Have controls include the risks from vibrating tools or machines can be minimised by introducing methods that eliminate, substitute or reduce the exposure to vibration, avoiding prolonged or frequent use of vibrating equipment, keeping cutting tools sharp so they remain efficient, making sure equipment is well maintained, wear and tear can increase vibration, avoiding forcing or gripping the tool more than is necessary, wearing gloves to protect the hands, exercising and massaging the fingers during breaks to restore circulation. Health surveillance is crucial to spot and respond to early signs of damage. Reduce noise levels as much as possible and keep people and unwanted sounds apart.